Hello and welcome to the ACE-IT podcast, where we turn science into sense. This is the lucky 13th season of ACE-IT, and we could not be more proud to deliver the rich scientific content to you in a usable and understandable way. ACE-IT is brought to you via the Justice Community Overdose Innovation Network, or JCOIN. If you're new to ACE-IT, welcome, and check out the prior seasons to begin or continue your learning journey. We are exceptionally grateful for every listener, and we promise we will continue working to help you learn and never let you down. Also, a quick plug for a few other JCOIN features. Did you know that you can get technical assistance for your organization from the experts at JCOIN? And did you know you can apply for small research grants to help fund an innovative study idea? Yep, also through JCOIN. And did you know you can apply to be a JCOIN Leap Scholar or investigator to improve your own skills? Also through JCOIN. If any or all of these exciting offerings sound interesting to you, check out our website, www.jcoinctc.org, and learn about the many JCOIN offerings beyond ACE-IT that may help you learn and grow in ways that improve lives, including your own. With that, I'm honored that you're with us. I'm Danielle Rudes, your host, and this is ACE-IT. Welcome to Season 13, Episode 8 of the ACE-IT podcast. This episode is titled Digital and Telehealth Tools, and it's part of Season 13 titled Evolving Responses to Opioid Use Disorder and Overdose. In this entire season, we're examining the shift in prevention, treatment, and recovery strategies in response to the ongoing opioid and overdose crisis in the United States and beyond. From emerging clinical approaches to peer-led efforts, we're highlighting the many ways individuals and systems are adapting to save lives and support recovery. Today, we're exploring a fast-evolving area in the response to the opioid and overdose crisis, digital and telehealth tools. From smartphone apps and wearable sensors to virtual overdose monitoring services, technology is increasingly being used to prevent overdoses, support recovery, and expand access to care. But how well are these tools working? And what do people who use them think? The landscape of digital health tools for opioid use disorder is broad. A content analysis of more than 1,000 opioid-related smartphone apps conducted by Williamson and colleagues 2025 found that nearly 300 were designed specifically for recovery support. Many offered features to boost motivation and accountability, and over half provided links to peer support or telehealth. But surprisingly, fewer addressed cravings or offered clear information about recovery, and many were locked behind paywalls or required private invitations. This shows promise, but also highlights gaps in accessibility and effectiveness. Health systems are also adopting digital tools. A study of U.S. healthcare organizations by Miller Rosales and colleagues, 2023, found that digital technologies like remote therapy, virtual peer recovery groups, and digital cognitive behavioral supports were being used primarily as complements to traditional care, not substitutes. In other words, these tools helped expand capacity, but did not replace in-person services. Wearable technology is another exciting advancement. One study found that more than 3/4 of people who use opioids would be willing to wear a discrete device that could detect an overdose and automatically deliver naloxone. Comfort, design, and trust in the device's accuracy were key factors shaping whether people would actually use it. Pilot studies using biosensors show the approach is feasible, though more sensitive devices and larger studies are needed to truly demonstrate impact. Researchers are also looking at how mobile health technologies can support overdose response. A scoping review of studies identified tools that connect people with detect overdose through biometric signals, or even administer antidotes automatically. Acceptability and accuracy remain central challenges, especially the need to design tools that are discreet, reliable, and trusted by people at the highest risk. Another area of research focuses on apps designed for community response. In Philadelphia, the Unity Philly app connects people equipped with naloxone to nearby overdose events. Interviews showed that lay responders use different rules of thumb when deciding whether to respond. Some always signaled for help, while others acted only if they thought they could make a difference. These patterns suggest that digital overdose prevention relies heavily on the backgrounds and judgment of the people using the apps. And when there are virtual overdose monitoring services, or VOMs, which connect people who are using drugs with remote operations or operators who can dispatch help if needed, people with experience using these services describe them as potentially life-saving, especially for those who use alone. Still, concerns about privacy, reliable phone access, and emergency response times, particularly in rural areas, were major barriers. Participants emphasized that trust with operators and availability of referrals to mental health and social supports were just as important as the monitoring itself. Others suggested that awareness could be expanded by placing VOMS information directly into naltrexone kits, which people found acceptable and feasible as a way to promote these new services. The promise of digital and healthcare tools is clear. They can extend care, reach people who might otherwise be isolated, and offer rapid overdose response, but significant challenges remain. Accessibility is a recurring theme. Whether it's smartphone apps hidden behind paywalls, wearable devices that are too costly, or VOMS programs limited by phone service and geography, trust also emerges as a crucial factor. People who use drugs need to believe the technology works, but also that engaging with it won't expose them to stigma, surveillance, or criminalization. Equally important is the recognition that these tools work best as supplements, not replacements, for human care. Apps and wearables can connect, detect, and support, but they cannot replicate the empathy and relationships that underpin recovery. As the technology develops, it will be critical to design each technology with users at the center, ensuring that tools are discreet, affordable, trustworthy, and integrated with the broader system of harm reduction and treatment. Digital and telehealth tools represent a powerful new dimension in the fight against overdose. From biosensors to apps to virtual monitoring services, technology is beginning to reshape how we prevent overdose deaths and support recovery. But as the research shows, their success depends not only on innovation, but also on trust, accessibility, and thoughtful integration into existing systems of care. Thank you for joining us as we explored the cutting edge of digital responses to the opioid and overdose crisis. Come back next time for another episode of Aced It. Thank you for listening to the Aced It podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me. Danielle Roods at Sam Houston State University in Texas. My email is droods@shsu.edu. And of course, thank you to the Justice Community Overdose Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous and amazing scriptwriters, and also my fabulous and amazing doctoral students, Bryce Kushmarek-McCune, Jalen Magana, and Caitlin Bauer. And a huge and heartfelt thank you to the team at Slonky LLC for their wonderful production as always. Tune in again soon for another episode and even a whole nother season of Aced It.